The countdown is on, not just to a potential shutdown, but to those healthcare law exchanges opening up. They're now just 62 hours and 1 minute away. And despite this growing list of employers shown on Investors Business Daily making major changes due to the law, President Obama says it's doing nothing to jobs.
They said this would be a disaster in terms of jobs. There's no widespread evidence that the Affordable Care Act is hurting jobs.
So come Tuesday, who will be right? Hi, everyone. I'm Brenda Butner. This is Bulls and Bears. Let's get right to it. Here they are, the Bulls and Bears this week. Gary B. Smith, Tracy Burns, Jonas Max Ferris, John Layfield, along with Bernard Whitman. Welcome to everybody. John, the impact on jobs?
Yes, absolutely. Look, I don't know where the administration's head is. It must be in the sand. And I mean, no offense to the administration, but people that are proponents of this are ignoring the facts. From Investors Business Daily, from the Express Employment CEO Bob Funk, who comes out and says our business is booming right now because people are hiring temporary workers to fill full-time slots to get around Obamacare. The administration has come out and said that health care costs are already coming down. The fact is, in 2009, you started to see this trend before Obamacare ever kicked in, and the Kaiser Institute just came out and said 77% of lowering health care costs, of not expanding, not lowering, but not expanding, came due to an economic slowdown. There is a huge cost to this. This is not free, and it's not just borne by the individual. This is projected to cost the government $1.4 trillion. We're going to borrow from China, and as Gary B. points out so well, very few government programs come in under budget.
All right, Bernard, you agree with him?
Absolutely not. In fact, 94% of employers have said they absolutely will continue to give health care to their employees. And so I think that while you have anecdotal evidence of a company here, a company there, saying they may not, widespread, absolutely not. In fact, it's going to be a huge boon to business because Americans will have confidence that their health care problems will be covered. They'll be able to get access to preventative care like 100 million people already have. In states like New York, where I am, costs are expected to go down by 50%. And so the fact that people can take their health care with them, won't have pre-existing conditions preventing them from getting the care that they need, won't have annual caps on benefits, lifetime caps on benefits. It's going to be a huge boon to the economy, a cost saver, and a driver of business.
Okay, Gary B., you've just been holding yourself back during that whole talk. Go ahead. Take him on.
I wish I could believe Bernard's rosy scenario, but I'm trying to come up with, off the top of my head, other massive government programs that have been a boon to the economy. I can't think of any. They're, normally, as John points out, they're horribly inefficient. I mean, this is going to be, I think, the big dig, if you will, the Boston construction project that was billions over budget and years over estimate of all government programs. But the thing I want to key on is two. One, what's going to happen to premiums? Across the board, it looks like younger people are going to pay a lot more in premiums. It's to be determined how much they're going to get back as far as credits, but initially the premiums are going to go up. Two, the even bigger concern is the quality of health care. Price Waterhouse has already studied this, and some major providers have been overlooked in this whole thing. Why? Because the government wants to restrict the suppliers out there to control costs. That's fine. The problem is when you restrict suppliers, you restrict the quality of health care. I think the quality of health care is going to go down. I think the lines and the wait to see specialists in particular is going to go way up. People are not going to be happy.
Okay, Tracy, when it comes to jobs, is hiring going to go down as well?
It is already. I mean, we hear it from Home Depot. We hear small businesses capping out. Bernard, I don't know who you talk to. The two businesses you talk to might think it's okay, but the rest of the world thinks that this is a bloody disaster, to the point where D.C. itself is opting out. They're saying, you know what, let's not sign up for this just yet to see how it goes. Not to mention, Brenda, we see it in the jobs number. You're going to see it, I guarantee you, this Friday in the Friday jobs number. We are hiring more part-time people. They are not rolling over to full-time. Why? Because companies do not want to take the risk because they have no idea how much it's going to cost.
Okay, Jonas, is it that black and white? You see some pros and cons here.
Yeah, and I don't think anyone will know exactly what's going to happen until it fully implements because there's so many moving parts and behavioral changes that are hard to predict. I mean, so far it actually looks like it's working because healthcare prices year over year have gone up less than they have through the last 50 years of this country. So I don't know how much of that is because of this plan taking into effect or how much is just because it can't go up more than inflation forever. But I'll just give you one little thing that's a little odd. It's, one of the reasons people get jobs is because healthcare is so expensive. You need a job for healthcare. That's going to change now with subsidies. It might lead more people to start businesses. Is that good for the economy or bad versus having to get a job to get health care? I don't know. We don't know until it happens. If they start bad businesses, it's not going to be good for the economy. So it's really hard to predict at this stage what the long-term effects are going to be.
John, if costs go up, jobs have to go down, don't they?
Yeah, it's supply and demand. It's economics 101. And Jonas, thanks for listening to me. I'll tell you again, the Kaiser Institute came out and said 77% of the lowering of healthcare costs had nothing to do with Obamacare. It had to do with the slowing economy, which started in 2009, way before Obamacare ever came around. That's a pure fallacy that is being used conveniently, which politicians do across the board. There's a reason that 35 of 50 states have opted out of these exchanges. They are simply too costly. There's reason that Cigna, that United Health have opted out of certain markets. What happened with Dodd-Frank is going to happen with health care. You had $2 trillion come out of the credit market, a $4.5 trillion credit market, because there was so much regulation put on businesses and nothing was done about the financial crisis. The same exact thing is happening with health care right now. You're going to lose coverage, like Gary B. has just said.
Bernard, why do you think so many states have opted out of the exchanges? Are they worried about jobs? Are they worried about the costs?
I think that they frankly just don't want to deal with it, and they are actually going to lose because big states like New York and California, who are operating their own exchanges, stand the greatest chance of actually delivering incredibly high quality of service at much lower cost to their citizens. And so, frankly, I think it's abrogation of responsibility. And for these states, many of whom are in the South, that talk about states' rights and the fact that they don't want the federal government reaching into purviews where the states are typically have power, ought to be ashamed of themselves because they're just abrogating their responsibility to the federal government. So if they think they can do a better job, they should do that.
70% of states.
But I don't know how you say that, though. I mean, there's so many doctors who are just opting out of medicine altogether because they don't even want to deal with this. I mean, medical student enrollment is down because people don't want to deal with this. Like, this can't be good for care going down the road.
You know who it's good for? It's good for 30 million Americans who are going to get coverage that
well,
don't
you know
have
what?
coverage
To
right
Jonas's
now.
point, we have no idea if it's going to be good for them. We have no idea if this is actually going to be good for society in general.
I think those people who will get coverage are going to think it's pretty good for them.
If they get it.
We also have no idea if rising healthcare prices are necessarily going to lead to less employment. Okay, let's pretend healthcare prices, the low change over the year, had nothing to do with Obamacare, which is totally possible, I agree. Then why isn't unemployment going down so much? We just had the lowest growth rate in healthcare costs in our nation's history, practically, because maybe that doesn't have that much to do with hiring in the grand scheme of things. We had periods where healthcare was going up crazy in the 90s and 2000s, and we had much lower unemployment. So I don't even know if this correlation exists that we're all so worried about in the first place. It's really going to be hard to tell. For one, you're getting more healthcare. Like, it's going to go up, but you're going to get more coverage. It's like if the government mandated that your home insurance had fire coverage, it's going to make the price go up, but you're getting fire coverage.
Well, here's what House Minority Leader Nancy Pelosi says that Obamacare is going to bring you.
The liberty to pursue your happiness, whether you want to be a photographer, a writer, start your business, be self-employed, change jobs. You're not job locked. You can follow your passion.
Okay, Gary B., she's very optimistic. You can do whatever you want because of Obamacare.
She could be talking about anything. She could be talking about the National Highway System, Department of Education. I'm not sure what exactly how that ties to Obamacare, but let's just take the most optimistic scenario. Let's just say somehow, to paraphrase Jonas, the government somehow can figure out all these moving parts. An impossibility, granted, but they can figure it out. Then what you have here is a program that will, even with all those moving parts, greatly exceed budget.
Right.
Look, you can make an argument that Medicare works, and it's way over budget. Same with Medicaid, with fraud, Social Security broke. The government may be able to kind of Rube Goldberg something together. It's going to blow the deficit wide open.
Okay, that's got to be the last word. Thanks, guys.